Hey everyone, it's Jake. Today, we're diving into 7 warning signs your heart might be weaker than you think. We often hear about heart attacks, but subtle clues can show up long before any major event. Ignoring these early signs is like hitting the snooze button on your health. Don't do it. If you notice any of these, especially if they're new or getting worse, talk to your doctor. Let's jump right in. Let's start with shortness of breath. It's something we've all felt at some point, maybe after running to catch a bus or climbing a few flights of stairs. But what if you find yourself gasping for air during everyday activities, or even while just sitting still? This can be unsettling, and it's important to pay attention to what your body is telling you. Sure, we all get winded after a workout, but if you're out of breath during simple activities, like walking to your car, carrying groceries, or even getting dressed in the morning, it could mean your heart isn't pumping efficiently. These are activities that shouldn't leave you feeling exhausted or gasping for air. When this happens, it's a sign that something deeper might be going on inside your body. When your heart struggles, it can't deliver enough oxygen-rich blood to your muscles and organs. This leaves you breathless, even after minimal effort. You might notice you need to pause more often, or that you're unable to keep up with friends and family like you used to. Sometimes you may even feel lightheaded or weak after doing things that once felt easy. Don't just chalk it up to being out of shape, especially if this is new or getting worse. It's easy to blame age, weight, or stress, but persistent shortness of breath is your body's way of waving a red flag. If you notice this symptom creeping up on you, or if it's suddenly much worse than before, it's time to take it seriously. Shortness of breath can signal heart failure, a condition where your heart can't keep up with your body's needs. In heart failure, fluid can build up in your lungs, making every breath feel like a struggle. You might also notice swelling in your legs or feet, or a persistent cough that won't go away. These are all signs that your heart and lungs are under extra strain. If you ever feel breathless with chest pain, dizziness, fainting, or a rapid heartbeat, get medical help immediately. These symptoms could mean you're having a heart attack or another serious emergency. Don't wait or try to tough it out. Call for help right away. Quick action can save your life. Even if it's not an emergency, make an appointment with your doctor to find out what's going on. Your doctor can run tests, listen to your heart and lungs, and help you get to the bottom of your symptoms. Sometimes, shortness of breath is caused by conditions like asthma, lung disease, or even anxiety, so it's important to get a proper diagnosis. Your body is trying to tell you something. Listen to it. Ignoring these warning signs can lead to bigger problems down the road. Pay attention to changes in your breathing, and don't be afraid to speak up if something feels off. Early action can make all the difference. By catching problems early, you give yourself the best chance at staying healthy and active. Remember, you know your body best. Trust your instincts and get the help you need. Noticing your shoes feel tight or your ankles are swollen? Occasional swelling can be normal, but persistent swelling in your legs, ankles, or feet could mean your heart isn't pumping blood effectively. When your heart is weak, fluid can build up in your lower body. This is called edema. If swelling sticks around, especially with other symptoms like shortness of breath or fatigue, get checked out. Swelling can have many causes, but don't ignore it. Let your doctor figure out what's really going on. We all get tired, but if you're constantly exhausted, even after a good night's sleep, your heart might be struggling. A weak heart can't deliver enough oxygen, leaving you drained no matter how much you rest. Chronic fatigue isn't just about being busy or stressed. It can signal heart failure, anemia, or thyroid issues. If you're always wiped out, don't just push through. Get it checked. Your energy levels are a window into your heart's health. We've all felt our hearts race from excitement. Maybe you're watching your favorite team win, opening a long-awaited letter, or sharing a laugh with friends. These moments make your heart beat faster, and that's completely normal. Sometimes, a strong cup of coffee or an energy drink can also send your heart into overdrive for a little while. But if you notice your heart suddenly beating rapidly or irregularly, especially when you're at rest or not feeling emotional, it's important to pay attention. These unexpected changes can be your body's way of telling you something isn't quite right. your heart's rhythm should be steady and predictable. If you start to feel frequent palpitations, those odd sensations where your heart seems to skip, flutter, or pound unexpectedly, it's not something to brush off. Sometimes these symptoms can signal a condition like atrial fibrillation, which is a common heart rhythm disorder. Atrial fibrillation can increase your risk of stroke and other serious complications, so early detection is key. You can easily check your pulse at your wrist by gently pressing 2 fingers on the inside of your wrist, just below the base of your thumb. Count the beats for 30 seconds and double it to get your heart rate per minute. Or try checking your pulse at your neck, just beside your windpipe. If you notice your pulse feels irregular, unusually fast, or even too slow, take note of when it happens and how long it lasts. Don't ignore these signs. Even if you're unsure, it's always better to be cautious and talk to a healthcare professional about what you're experiencing. Occasional skipped beats are usually harmless, especially if they happen infrequently and don't come with other symptoms. Stress, lack of sleep, or too much caffeine can sometimes be the cause. But if you notice persistent changes in your heartbeat, or if you feel dizzy, short of breath, or faint, it's time to see a doctor. Your heart is too important to take chances with. Remember, your heartbeat is your body's natural rhythm. Keeping it in tune helps you enjoy life's best moments with energy and confidence. Listen to your heart and don't hesitate to seek help if something feels off. A lingering cough isn't always from a cold or allergies. Sometimes that persistent tickle in your throat is your body's way of signaling that something deeper is going on. While it's easy to blame a cough on a passing bug, it's important to pay attention when it just won't go away. If you have a persistent, dry cough, especially one that seems to get worse at night or when you're lying down, it could actually be a sign of heart trouble, not just a stubborn cold. Many people don't realize that their heart can cause symptoms that seem unrelated at first. When your heart isn't pumping blood as efficiently as it should, fluid can start to back up into your lungs. This buildup leads to what's known as a cardiac cough. It's your body's way of trying to clear out the extra fluid, and it can be a crucial warning sign that your heart needs attention. This type of cough can easily be mistaken for a simple respiratory infection. But if it lingers and you notice other symptoms, like swelling in your legs or ankles, feeling unusually tired, or getting short of breath even with mild activity, it's time to take it seriously and talk to your doctor. Remember, your lungs and heart work closely together. A cough that won't quit could be your heart's way of asking for help. Don't ignore it, or hope it will just go away on its own. Listen to your body's signals. If you're experiencing a nagging cough along with other unusual symptoms, reach out to your healthcare provider. It could be your heart asking for help, and early action can make all the difference. Chest pain is your body's loudest alarm. Never ignore it. Any chest pain, pressure, or discomfort could signal a serious heart problem. Angina feels like tightness or pressure, often triggered by activity or stress and relieved by rest. A heart attack is different. Crushing pain, shortness of breath, sweating, or nausea, call 911 immediately if you feel this. Not all chest pain is a heart attack, but it's always better to be safe. When in doubt, get checked out. Your heart's too important to risk. Feeling foggy or forgetful? Trouble concentrating can be a sign your heart isn't pumping enough blood to your brain. Your brain needs steady, oxygen-rich blood to work well. If your heart can't keep up, you might notice confusion or memory problems. Sudden or worsening brain fog, especially with other symptoms, deserves a doctor's attention. Don't just blame it on age. Your heart could be the culprit. Those are the 7 signs your heart might need attention. These symptoms don't always mean heart failure, but don't ignore them, especially if they're new or getting worse. Early detection can prevent bigger problems, so see your doctor if you notice any of these. Take care of your heart and it'll take care of you.